Hello, welcome to the workshop on Wednesday. I'm Jake Alsop and I'm Associate Osteopath at Kennington Osteopaths and Physiotherapy. Today we're going to be looking at neck pain and a few exercises onto how to try and manage neck pain. This might come from various avenues of injury, or it might just be like a little neck strain. These exercises work well for a variety of things. So people that have hurt it acutely, like carrying objects or at the gym, and it might just be from neck ache or discomfort from working for long hours of the day, sat down. And you can also get the acute pain from that, because what happens quite a lot is you're sat at work and you're getting quite a lot of pressure through the neck while working on a laptop, and then you go and do some exercise and your muscles being held, lengthened and fatigued, and then you get a bit of an injury that way. It's a good thing to note that, when you're sitting there, your head weighs 8 pounds. Every time you move forward a degree from the centre of gravity, that weight is doubled, so that 8 pounds becomes 16 pounds, and it can become quite a toll on the muscles of the neck. If you're sitting there all day, or maybe just for 2 hours with the head slightly forward, because no one's perfect at keeping their head on top of their shoulders while they work. There's a lot of strain going through the muscles. Imagine if you were to hold a squat for that long. Your muscles are going to be absolutely knackered by the end of the day. So it's the same with holding your neck and just holding your head for that long as well, without moving. And so lack of movement, that's quite important as well. So some of the exercises we're going to do, we're just going to aim to get some mobility back, and actually to engage the muscles, not just stretch them. It's the same with a lot of the things I do on here. We want to move away from that mindless sort of static stretching and focus a bit more on being more active, getting some active mobility back, and engaging the muscles to increase that circulation, okay? So with that in mind, I'm going to break the exercises down today into, I think, 2 stages. The first stage is going to be just some mobility and some gentle activation. And then the second stage is going to be a bit stronger, so we're going to be using bands, and we're going to be using some tools. So I've got a stretchy band, and I've also got an umbrella. Now with the umbrella, it's important to have this hook on it, okay? It's the hook that we need, so if you have anything else with a similar hook, then you can use that. There is an alternative that we can do. And you could do it with an umbrella as well, with a straight edge, but it works also quite well with a tennis ball and a pole, and I'll go through that when we begin doing that exercise. Alright, so first exercise in mind, we're going to try to get some mobility back into the neck. So for this you can use a belt, okay? What happens when we get neck pain is we often lose the rotation. So you go to turn one way and it doesn't like it. Usually if you turn left and it's painful, that means something going on the left. But in certain cases it can mean there's a muscle being stretched on the right. Either way, what I find is in clinic, if I get a person to stand up and move the head, they get pain. If I do it myself lying down, I can get much more range. And just getting the articulation back is helpful. So with that in mind, we're going to try to get some passive neck rotation in, okay? Let's do this. Pop a belt around your neck. I've tried it with a towel. It works with a long towel, but I think it works better with a belt. Opposite hand onto the buckle. I'm going to pass this round, okay? Just near our chin. And the idea is to give your head a bit of a helping hand in that movement. You'll find that if you've got acute neck, getting here is painful. If you just give it a bit of a nudge, try your best to relax. It works well if you're sitting down for this, so you can relax your back into the chair. And just help that neck along. Then you do it the opposite way. So your hands are crossed over. So this is a nice way to get that rotation into the neck for an acute neck, okay? If it's not an acute neck, this is not going to do much for you, so you can just leave that alone, alright? Next exercise is, for that you're just going to do as much as you need. Usually it's about 5 times. You might do it 2 or 3 times each side. And it just helps get a bit of movement back into there, okay? Next is some isometric exercises. So that's pushing and resisting but not moving. I'm going to do all ranges. So that's side bending, rotation, flexion and extension, alright? And you're just going to push against yourself. This is to engage the muscles and then relax the muscles off, but without going through the movement, okay? A lot of the time why you get pain is because the muscles engaging and lengthening or contracting. We're going to get that contraction, shortening. We're going to get that contraction without moving. So firstly for flexion, just going to push down. For 5 seconds, alright? And you relax. And you can do that from various angles. So you might try it from neutral. You might try it a bit closer. You might try it from a slight extension. Do that for 5 seconds. About 3 times. And you essentially do a 3 by 5 seconds in all areas. So, this time, I'm going to go up. And again, 5 seconds, and you can do various angles there as well. Whatever you need. Sideways, so pushing that way. I'll be 3 by 5 seconds. And then the other way. And again, it's 3 by 5 seconds. You may want to try to increase the stretch each time. So, let's take this one for example. Relax and stretch away. Push into it. Push for 5. Relax for 5. Then increase the stretch. And go as far as your body allows you. And after about 3, you probably get to your range, 3 or 4. And then rotation. So I'm going to rotate this way. Rotate to my right. I'm pushing and relaxing. And I'm pushing and relaxing, okay? Both directions. So once you've done all the isometrics, that's a nice way to engage everything. You may want to just get the shoulders rolling as well. Statically, just straight up and hold and relax, and then some rolls too. That routine is really good for like a working day. So if you know you suffer from neck pain after a long day of work, even if you just do every half an hour, get the shoulders rolling, both directions, do a bit of holds and relax, hold and relax, and then just do some quick isometrics, just to get the blood back into the muscles and the action go around the muscles again. That's a great thing to do during work. But it's also good for that acute neck pain as well. So I'm going to go into a bit more of the stronger exercises. So the first thing we're going to do is some bandit work, okay? What I give quite often is holding a band in one hand, and it's basically a shrug and a stretch. We do the shrug to engage the traps and engage some of the muscles back here, get some blood into them, and then we follow it up with a stretch, okay? So, get a band. I like for it to be quite strong. You can also use weight. So after I move my band over, I'm going to stand on it, okay? Now you want the pressure to be on straight away. So I can feel tension now. I'm going to bring it all the way up to here. So there's tension going down, okay? It's pulling my shoulder down. What you're going to do is do a shrug and a stretch. Shrug up and stretch. And you may need to start small. You may need to start with a little shrug and a little stretch, okay? But then bring it up to your ear, stretch it out. When you're stretching out, Make sure the shoulder is being pulled down towards the ground, okay? And you can change the direction of stretch a little bit too. If you put your foot back, it may, in relation to your body, it's going to pull your shoulder back a bit. So it's nice to go forward, and it's going to get a bigger stretch in the back. Alternatively, you put your foot forward. You can start getting more of the anterior fibres of that trap. It's a really strong stretch, okay? Remember to shrug and stretch it out. If you do about 20 of these, that's going to start to really open up your shoulder and your neck. There's another one that's really nice, which starts to get the scalenes a bit more. The scalenes are these muscles in the side and the front of your neck. To get that, there's two options. Either attach this to the door, so like a door handle, so it'll give you this height, or you can step on it and lunge away. I'm going to do the step and lunge because it's the most complicated one. But just remember, you can tie it to a door handle if you want. So the step and lunge, I'm going to be treating my right side, okay? Going to pop on it there, and go behind the back. Just going to make this a little bit longer, there you go. And then lunge away, alright? Make this really tight, so it's pulling your arm back behind you. So my arm's going to be coming back towards my left hip here, and you can just see my fingers poking out the side of my bum, so it's pretty much on my bum and my left hip. Then from here, we're just going to really introduce that twist to the body. Again, if it's on the door handle, it's going to be really twisting your arm this way. So get a good stretch through there. Lunge away, okay? And now it's going to create tension on the anterior shoulder. Look left and tilt your head back. It's going to start to get a stretch down the front of your neck and across the pec here. What we can do then is just add a bit of a fascial stretch. So literally put your fingers on your skin, almost like you're moving your skin around, and you're going to start stretching away, okay? So I'm putting a little bit of tension through the skin here whilst moving my chin away. And you're going to move around that collarbone and try to move away from your finger. So if you're down here, go more straight back. If you're over here, move away, okay? So work together with your hand. And if you wanted to, you can come above the collarbone, more into the muscles, and get more of a muscular stretch. If your right hand starts to get a bit tired or starts to get a bit numb just because it's so tight, just bring it back, let go, and shake it out, okay? And again, it's going to feel slightly different if you attach that to a door handle at this height. That pull is going to be at a slightly different angle, okay? It's a really good stretch for the neck. It's not so great if you have anterior shoulder issues. That stretch included with the shrug. So that sort of fascial stretch and the shrug and stretch are really powerful for the neck, okay? And doing them nice and slowly controlled over and over, for a few minutes, is going to bring some relief to the vast majority of neck issues. It may not resolve them, but it's going to help you. Another great one is addressing the similar muscles and addressing some of the mechanics in the top of the chest, okay? So the first rib. Your rib cage is all here. Your first rib is right up in here, okay? First and second rib are here and here. So for this, we're going to use some tools. If you have your umbrella with a hook, you can pop this behind you using this hand. Where is it? There we go. I'm going to show you from the down. And get it into that sort of sulcus between. So you have your collarbone, your neck coming down here. So there's this little triangle between this big fat muscle here and the collarbone. When you just get it into there. There we go. Find your umbrella. Make sure it's hooked on, okay? So I'm in this position. Alright, your umbrella's pointing that way. And it's hooked in there. Now you're going to play around to where you feel the best, okay? Have it there. Firstly, just deep breaths. If it's sore, pull lightly. If you feel it's beneficial for you, Push a bit harder if it's not creating pain. It's just creating a bit of a nice ache. There we go. It's right into the good muscle there for me. Just some deep breaths to start. Really feel your belly expand and your chest rise. You find after you do a few breaths, even just for 20 seconds, you probably have to get this in a bit deeper. Once that's in, we're now going to do 2 minutes of shoulder flexion. So you're just going to go up and down the shoulder. Keep the pressure going through the umbrella. And just going up and down, okay? And you're going to be doing this whilst maintaining pressure into the shoulder using this hook. You're going up and down. You can play around with it whilst you're doing it. Okay? Now, alternative methods of this would be to get an umbrella with with the handles just straight. The umbrella's good because it means the end of the handles are usually quite thick, so they're not too pokey. You know, I wouldn't want you using this, that's too aggressive. If you have something like this, what you could also do is get a tennis ball. Carefully get a knife and cut a little X into the tennis ball and just pop it on top. And what you're going to be left with is basically something like this, just sitting on top, like a trigger ball on top of the umbrella. And all you'll do is lie on your back, or use the straight edge umbrella. Lie on your back on your floor. You'll wedge your umbrella in, and it's going to have a spike there, okay? Just lie down, have more space than I do, and pop it in to that same spot. Then using your legs, just push away and put the pressure in that same area, okay? And it's like, there we go. And then I'm just gonna hold it in for now because I haven't got a tennis ball holding this. And then do the same thing, deep breaths. And then after about 20 seconds of deep breaths, you might want to wriggle a little bit further that way to get a stronger application. And then the same thing. Okay? 2 minutes of just up and down. So you can do that sitting up with the umbrella or lying down. Okay? Now, that's pretty much everything. All those movements are going to help you relieve some tension and pressure off the neck. Depending on where your issues are, you may want to focus on various things. So if you're having pain coming down the back of the neck and you're struggling to lift your head up, it's actually probably a good idea to practice that movement, but really carefully. So just pushing really gently, alright? Try to get your muscles working in that range again, but just do everything really slowly and really gently. If you're getting any of the symptoms, such as headaches, dizziness, if you're getting any symptoms down the arm, into the fingers, that might be shooting pains, it might be like a trickling feeling. It could sometimes be pins and needles and numbness in the hand. If this is happening, then you're getting some sort of neuropathy. So you're either getting a nerve ending affected in the neck, or something getting trapped down the arm. Okay. The same thing can be said for the tension headache. Not for tension headaches. Cervicogenic headaches coming from the back here. They present as like a pain here, and often behind the same eye. It may be something else, but usually comes from tension and restriction in the occipital region here, affecting the nerves in that area, okay? If you're getting this or getting symptoms down the arm, I'll suggest actually getting it investigated, so booking in an appointment and finding out what's going on there specifically. And they often need a bit of help from a practitioner first. And then once you have it opened up, you can go into doing all the rehab stuff that we've just covered today. So give them all a go. Start off slow and gentle. Find your capacity and find your thresholds, and just slowly push them and try to increase the stretches and the range. Essentially, you're taking messages. Don't just mindlessly stretch a muscle. You want to actually activate it first and take it through an active range and an active mobility, okay? And that's a way you're going to basically warm up your muscles and then get them working properly again. So give them all a go. If you have any questions, just either comment on the video or feel free to send me a personal direct message at Jake Alsop Osteopath. And I can give you some more tips basically, or we can have a little chat about what might your neck pain be coming from. If you haven't already looked at the upper thoracic stiffness video, I think it was last week, have a look at that, because stiffness in the upper back is a massive cause of neck pain as well. So it's usually a good idea to do both at the same time. Have a routine of doing your neck during the day at the office to stop it from getting sore. But then when you get home, go through mobility sequence for your upper back as well, to take the pressure off the neck in the first place. Good, so that's all for today. I'm going to be back next Wednesday with more tips and exercise ideas. In the meantime, have fun and enjoy your evening.